Hello, my name is Jasmine Taylor, and I would like to take a moment today to talk to you guys about medication error awareness and prevention. Medication errors are just more common than most people think. You go to a hospital and you feel safe and you trust the people providing care for you, but sometimes we don't realize these people are humans and humans make mistakes. I was first enlightened about medication errors a couple years ago when several of the pharmacies that I worked for started really promoting medication safety. And I'm like, okay, what's going on? We were shown these videos of these people that were involved in accidents, some horrific accidents, and you wouldn't think a person would survive, but they survived these accidents, only to come to a hospital and be killed by a medication error. So I was pretty shocked by that. A few years ago, a famous actor, Dennis Quaid, had a close encounter with a medication error when a massive dose of heparin was given to his newborn twins. And heparin is a blood thinning medication, by the way. CBS News 60 Minutes show reported on this back in March of 2008. They were given an adult dose instead of their pediatric dose that they were ordered. They survived the mishap, but their parents have used this ordeal to shine light on medication errors, and hopefully, with their fame, they can help spread the word and prevent them. On the flip side of that, NBC News reported about a Seattle children's nurse who gave another baby, a lethal dose of calcium, and she later committed suicide over the mistake. And this really highlighted that there may be two victims in a medication error, the patient and also the provider. NBC News reported that providers often involved in medication errors suffer from anxiety, depression, and they even contemplate suicide. Medication errors are unintentional errors in the prescribing, dispensing, administration, or monitoring of a medicine while under the control of a healthcare professional, patient, or consumer. In a report to Err is Human, the Institute of Medicine estimated 7,000 deaths in the U.S. each year are due to preventable medication errors. They also reported in 2006 that medication errors cost the U.S. roughly around $3.5 billion. Medication errors can occur for multiple reasons, but a few of them that I found in the article FDA 101 medication errors were miscommunication of drug orders, poor handwriting, confusion between drugs with similar names, poor packing designs, and the confusion of metric or other dosing units. So now that we see the magnitude of medication errors from several different angles, what is being done to prevent them? Well, I found that many institutions, hospitals, pharmacies, doctor's office, etc., have and are implementing more safer practices and procedures. There's one process called double check. When two nurses, one nurse, draws up a medication that is high alert or is about to administer a medication that is a high alert medication, for example, like insulin or chemotherapy, it is required that another nurse come and double check that she's given the right med and the right dosage. Because some high alert meds, it only takes one time you give the wrong dose and the person can die. It can be fatal. There's also forbidden abbreviations in prescription writing, which was a national patient safety goal by the JCAHO, which is the Joint Commission of Accreditation of Healthcare Organizations. And all hospitals must abide by this. For example, you can't just simply write a U if you're writing the word units. You have to write out the whole word, because the U several times can be confused for 0 or 4 if not written properly, and this can help prevent a lot of errors as well. There are also many assistive electronic devices that help prevent med errors, like the automated medication dispensing machines. Some of them have scanners on them. You can scan the med that you're getting ready to give and check it against an electronic MAR or a medication administration record, and that also can help prevent errors. Another process in most healthcare practices is read back and verify, which is simply when you're taking an order over the telephone, you have to read back exactly what the doctor said and verify everything he said. Just like if you were placing an order at a fast food restaurant and they would, confirm your order before placing it with you. And that's good because, we have a lot of cultures here in America, and there could be language barriers or simply environmental noise that might, be in the way of you being able to hear clearly. There also are organizations that healthcare institutes report med errors to that help analyze these errors and provide education to everyone for similar or common medication errors. A good program is the FDA MedWatch. Many hospitals are also providing clinical pharmacists on the floors in patient care areas to be readily available to doctors and nurses and patients. And, just their presence alone can help prevent a lot of errors on the forefront. And lastly, when we are patients, we have to do our part to effectively communicate to our healthcare providers about our current medications. Some people get embarrassed and don't want to disclose every medication they take, especially if it's not legal, and about our allergies, because some medication errors are due to just simply an allergy. So now that we are more aware about medication errors, hopefully we can all be more vigilant about the medications we take and possibly help to educate others about the dangers of not using medications safely. Medication errors are preventable, and we can all play a role in being more cautious and practicing medication safety when using it for ourselves or giving it to our loved ones, the patients we care for, or even our pets. People forget about our pets. So let me leave you with a quote from an anonymous author. Better dead sure than sure dead. It's harsh, but I think it really speaks to the degree of danger in medication errors. So play it safe. Thank you, and good day.